Hello everyone, welcome to Community Medicine Insights. In today's video, we'll understand the difference between quarantine and isolation, which are the two essential public health measures which are used to control the spread of infectious disease. Although these terms are often used interchangeably, their purpose, timing, and the target group are completely different. Let's begin with the definition. Quarantine refers to the restriction of activities of people who are not ill but have been exposed to an infectious agent during its incubation period. While isolation refers to the separation of ill or infected person from others to prevent the spread of infection. So isolation is done for the sick people and quarantine is done for the healthy but exposed people. As stated before, the quarantine is done for the healthy but exposed individual. The goal is to monitor them throughout the incubation period and prevent the possible transmission, while isolation is done for the sick and infected individuals. And the purpose is to break the chain of transmission. Now the question arises for how much period we have to quarantine or isolate a person. In the cases of quarantine, that period is not longer than the longest incubation period of the disease. For example, incubation period for any disease is 6 to 10 days. So here the minimum time is 6 days and the maximum time is 10 days. So if a person is exposed, that person is quarantined for the longest incubation period, that is 10 days. In the cases of isolation, the patient is isolated till the period of communicability. This is a period during which an infectious agent may be transferred either directly or indirectly to the another person. Period of isolation will also vary from disease to disease. For example, in the case of chickenpox, until all the lesions are crusted, and that period is usually about 6 days after the onset of rash. While in the cases of mumps, the patient is isolated till the swelling subsides. In some diseases, when there is a large component of either the subclinical cases or the carriers, in such cases, the physical isolation will not prevent the spread of infection. Here, in case of physical isolation, the chemical isolation is preferred. Chemical isolation means with the rapid treatment of cases in their own houses, rendering them non-infectious as soon as possible. So, in cases of a highly contagious disease, where the cases are subclinical and there are a lot of carriers, the role of physical isolation is very less. When do we use quarantine? Close contact of diseases like COVID-19, tuberculosis, measles, influenza, travelers who are returning from high-risk areas, household members who are exposed to a case, and contacts of zoonotic diseases. When do we use isolation? Isolation is done in the cases of confirmed COVID-19 cases, TB patients, measles, chickenpox, diphtheria, cholera, and Ebola, and hospital-acquired infections. What are the different types of isolation? That includes the standard isolation, strict isolation, protective isolation, and high security isolation. We'll see them one by one in the upcoming slides. Standard isolation means the basic infection control precaution which we apply to all the patients irrespective of their diagnosis. And its key component includes the use of hand hygiene, use of gloves, masks, gowns when required, safe injection practices, and the proper waste disposal. The purpose here is to prevent the infection from the blood, body fluids, secretion, excretion, non-intact skin, and the mucous membrane. According to strict isolation, it is used for the highly contagious and dangerous infections that can be spread easily by the air, droplet, or contacts. The key components include the patient in separate room, negative pressure rooms for airborne infections, mandatory mask, gown, and gloves, and the restricted visitors. Examples include the isolation in viral hemorrhagic fever, SARS cases, severe COVID during the aerosol procedures. Protective isolation is also known as a reverse isolation, and it is a set of infection control practices which are designed to prevent the infection in immunocompromised patients. Here, the patient is not the source of infection, but the danger comes from the visitors, hospital staff, environment, or the other patient. Why it is needed? Because the people with the low immunity, they are extremely vulnerable to various opportunistic infections, hospital-acquired infections, airborne and droplet infections, and the fungal spores, bacterial, and other viruses infection. So the protective isolation aims to reduce exposure, maintains a sterile environment, and to prevent the transmission of infection to the vulnerable patient. Who are the patients who require a reverse isolation? Chemotherapy-induced neutropenia, bone marrow transplant patients, patients of severe burns, immunocompromised patients like in the cases of advanced HIV, aplastic anemia, any other critically immunocompromised patient who are at high risk of infection. The key components include the positive pressure rooms, sterile or HEPA filtered air, strict hand hygiene, and limited number of visitors. Here, the purpose is to prevent the infection from reaching the vulnerable patient. Coming to high security isolation, it means specialized isolation which are used for extremely hazardous, exotic, or the highly lethal pathogens which require maximum containment. It is used for various viral hemorrhagic fevers like Ebola, Marburg, novel emerging pathogens, and bioterrorism agents. The key components include the high containment isolation rooms like BSL-3 or BSL-4 type, full body powered air purified respirator, strict entry exit protocols, and highly trained specialized staff only. The purpose is to prevent the escape of high risk pathogen into the community and to protect the health workers. To summarize, quarantine is done in the healthy but exposed individuals, and it is done till the longest incubation period. Isolation is done in the sick individual or symptomatic individual till the period of communicability. In reverse isolation, it is done for the safety of patient and to protect the immunocompromised patient